All right, let's talk about one of the most common and, let's be honest, frustrating skin conditions out there: acne. Today, we're going to break down what causes it, the different types you might see, and most importantly, we're going to build a clear action plan. Let's dive right in. Oh, we've all been there, right? The day before a big presentation, a wedding, that first date, and boom, an unwelcome guest decides to set up camp right in the middle of your face. It's so frustrating, and it can feel totally unfair. But here's the thing you have to remember: you are definitely not alone in this. It's an incredibly shared experience. So let's try to move past that frustration and get into the facts. We're going to get into what's actually going on under the surface of our skin. Okay, first things first. What even is acne? To really tackle something, you've got to know what you're up against, right? And it turns out it's a little more complex than just a random spot that pops up. So let's get this straight right away. Acne is a medical condition. It has absolutely nothing to do with being dirty. At its core, it's all about our hair follicles getting clogged up. Think of it like a tiny traffic jam caused by a mix of dead skin cells and sebum, which, by the way, is just the natural oil our skin makes to keep itself healthy. And if you ever felt like everyone had it in high school, well, you weren't wrong. While anyone can get acne at any age, it really tends to peak in our late teens. Why? Well, it's all about hormones, which are basically going wild at that age and telling our skin to produce way more oil. For a lot of us, it's just a biological rite of passage. But here's the thing: not all spots are created equal. Knowing what you're actually looking at on your skin is the key to treating it the right way. So let's become skin detectives for a minute and break down the different types. First up, we've got whiteheads. The technical term is closed comedones, which is just a fancy way of saying the pore is completely blocked. It traps all that oil and gunk under the skin's surface, which is what gives them that classic whitish look. Then you've got their cousins, blackheads, or open comedones. Now, the pore is still blocked, but it's open to the air. And that black dot, it is not dirt. It's just what happens when the trapped oil and skin cells get exposed to oxygen. They oxidize and turn dark. And of course, there's the classic pimple. This is what happens when that clogged up pore we've been talking about gets a little bit of bacteria in it and becomes infected. That redness and pus you see, that's actually a good sign. It's your immune system's army rushing to the scene to fight the infection. Finally, we have nodules. Now, these guys are a more severe form of acne. They're large, solid, and often pretty painful lumps that are way down deep in the skin. And because they're so deep, they have a higher chance of causing scars, which is why it's so important to see a doctor if you're dealing with these. All right, so we've got the what down. We know the different types of spots. But now let's get into the why. What is the actual chain reaction that causes these things to show up in the first place? It really breaks down into 4 simple steps. First, you get that buildup of oil and dead skin cells we mentioned. That stuff creates a plug, which blocks the hair follicle. Well, that warm, oily, blocked-up pore is pretty much a perfect little home for bacteria, so it starts to multiply. And finally, your body senses this unwelcome party, sends in its defenses, and that's what causes the inflammation and redness we see. So what kicks this whole process into high gear? Well, there are a few common triggers. Hormones are the big one, which explains the whole puberty thing. Genetics also play a huge role. Yep, you can thank your parents for that one. And for some of us, other things like high stress levels or even certain foods can flip the switch and cause a flare-up. Okay, we've explored the problem from all angles. Now for the part you've been waiting for: the solutions. Let's talk about the action plan for managing acne and getting on the path to clearer skin. Your treatment plan really depends on how severe your acne is. For milder cases, you can often find what you need right at the pharmacy, things like face washes or creams. But for more stubborn or severe acne, a doctor can bring out the bigger guns. They can prescribe things like antibiotics to kill the bacteria, or retinoids, which are these powerhouse vitamin A derivatives that are amazing at unclogging pores. Now, this is probably the single most important thing to remember. No treatment, and I mean no treatment, works overnight. It usually takes 2 to 3 months of using something consistently to really see a difference. So please, be patient. The key is to stick with your routine, even when you feel like nothing's happening yet. You know, treatment is about reacting to breakouts that are already there. But long-term care? That's all about playing defense and preventing them from happening in the first place. So let's chat about the simple habits that can help keep your skin healthy and happy. All right, let's run through the do's. These are the daily habits that can make a huge difference over time. Use sunscreen daily.
This is non-negotiable, especially since some treatments make your skin extra sensitive. Always take your makeup off before bed. Shampoo oily hair often so those oils don't transfer to your face. And wash your face twice a day, but gently, with a mild, soap-free cleanser. No aggressive scrubbing.
Now for the don'ts, the things we really want to avoid. I know it's tempting, but please do not squeeze or pick at your spots. It can actually push the infection deeper and lead to scars. Also, don't overwash your face or use harsh scrubs. That can irritate your skin and make it produce even more oil. And be mindful of things like heavy oil-based makeup and tight clothing that can trap sweat and oil against your skin. And we really have to talk about this because the impact of acne isn't just skin deep, is it? It can seriously mess with your self-esteem and how you feel about yourself. If you find that it's making you feel down or you're starting to avoid hanging out with friends because of it, that's a completely valid reason to talk to a doctor. They're there to help with all aspects of this. So let's end on this thought. Instead of chasing some idea of perfect skin, what is one small, kind step you can take for your skin and for yourself today? Maybe it's just committing to gently washing your face tonight. Or maybe it's making a promise to yourself not to pick. Real progress starts with those small, kind steps. Thanks so much for watching.